Today we are going to deal with fifth sample from the official OET website. Thank you OET for allowing me to use this for teaching purpose. So reading part A in 10 minutes easily, it can be done in 10 minutes, maximum 12 minutes. So tip number one, begin with a skim. Skim means fast reading. And tip number two, focus of each text. As of now, cellulitis is the title. Focus is first text speaks about definition and etiology. Etiology means it will speak about the causes, right? What are the causes? Then severity or drug therapy, then management of affected area. So we can say definition, then severity means could be something like complications, then medication, then management of affected area. Focus on these each text. The first 7 or 8 questions you can just dash through because there will be synonyms of these side headings, text headings. Tip 3, skim and search for these clues. What are the clues? Names of some condition, some organs, some medicine, anything of that sort. Names, any names, just highlight those names or focus on that. Then number, percentage or measurements or dosage, you can say in medication. Dosages are important. Number means also dosage. Then sequential expression. Sequential means there will be some sequence, first, second, third, or that way there will be some sequence in the reading. You can even focus on that. Time expressions probably will be there. Then scale expression and adjectives and negative expressions. These are the major things you'll have to just look into. So text headings, subtopic of each para. Text headings here you have. The main heading is cellulitis. Text heading is definition and etiology. Severity of cellulitis, suitable drug therapy for typical cellulitis, and management of the local affected area. So what you can do, just write down on the when you practice, just write down on the paper. In short, you can write definition and etiology, then severity, then therapy, drug therapy or therapy, then management. Simple 1 words, whatever you understand, just for your purpose of understanding, write 4 words. That will be cool. Text heading, subtopic of each paragraph. So this is what I said. So when you look here, what do you understand from the heading? It speaks about definition and etiology, means cause. Maybe here you have definition. Okay. Here you have definition. See, this is definition. Then you have that cause. It speaks about causes, Then the whole thing repeated again, cause here. So you can simply see the same word repeated time and again, which says this speaks about cause. So what could be the answer? A cause could be the answer. And coming to second text, this is severity of cellulitis. Severity means intensity, class 1, class 2, class 3, class 4. So when you skim, what you have to look into? These classes. Okay, in the question, they will give you a class. Immediately, if they are asking about class 3, you have to dash into that column. Immediately, you will find the answer there. Okay, that's how you skim through the text. And again, you have text 3, suitable drug therapy. Immediately, it is about medication. What will be the answer? When the class is given, subheadings are given, you have to focus on the class. Then medicines. The questions will be definitely on medicines and dosages. So immediately, you have easy, what you call, track lines here, class 1, class 2, class 3, class 4. So you can just jump into that. We'll go is management of the local affected area. How do you manage? Whatever comes in connection with managing the cellulitis or the affected area, answer will be in how to go about the first one. Now come on, answer. So here, what is the synonym you find about these words? First one. Cause, then otherwise, okay, there are 2 things now, treatment and etiology. Let's check. Then the second one, reason for drawing around the area affected by cellulitis. So important word is reason. Right? Yeah, because reason for drawing around the area affected by cellulitis. Third one, treat. Yes. Then here again, symptoms.
Equipment
For ensuring that patient's legs are more comfortable in bed. Equipment.
Medication.
Alternative medication. The 7th one, how to deal with the infection site after the swelling has begun to reduce.
Infection site.
Yeah, when infection happens after treatment or before treatment?
After treatment. Management.
Management. Okay. Let's check. We will not confirm now. Then who should be consulted regarding pharmacotherapy for cellulitis? Consultation comes under which heading? As you said, treatment highlighted, it should be C here. I am not confirming it. Let's check. Second one, reason for drawing around the area affected by cellulitis. Drawing around the area affected by cellulitis. Why do you draw? When do you draw around the area? When it happens, before the treatment or after treatment?
After the treatment.
Yeah, let's check. We have put D there. After the treatment means it will be management, right? Let's check, no problem. Then a system for determining where and how best to treat. Where and how best to treat patients with cellulitis. So here they are asking where and how best to treat. Depends on what?
Severity.
Yeah, severity, exactly. So it will be B. Okay. Fourth one is symptoms that may be experienced before the infection is visible.
Father.
Fourth one, A. Okay.
A, Father.
Equipment for ensuring the patient's legs are more comfortable in bed.
Next, D, management.
Management. Okay. So you know these things without even reading. Okay. We haven't gone to the text to refer. Alternative medication for cellular patients who cannot tolerate one type of antibiotics.
C. Therapy.
C.
Medication is there, right? Medication. So it must be C.
C.
Okay. Then how to deal with the infection site after the swelling has begun to reduce?
Management.
Yes. D. Yes. See, how to deal itself is a synonymous expression of management. Who should be consulted regarding pharmacotherapy for cellulitis?
C.
Yeah.
C.
Let's check. I have the key here. I'll check. Okay, I'm reading from the key here. Number 1 is C. Number 2 is D. Number 3 B. Number 4 A. Number 5 D. Number 6 C. Number 7 D. Number 8 C. Are they all right?
Yes, Father.
Yes, Father.
Yeah, that's it. So simple as that. Definitely you can do this and run fast and complete and come back because you have 15 minutes, right? This can be done within fraction of seconds. As you read through, you will mark. Now, as I'm teaching, it takes more time. Otherwise, you can just mark and go. Maybe you can confirm when you revisit back if you complete it in 7 minutes or 10 minutes. Then you have 5 more minutes to check with the. Definitely you have to confirm it with the text. Okay. Let's see now the same way. Now coming here, which antibiotic formulation is not suitable for treatment of cellulitis?
C.
Treatment.
C.
Treatment C. Okay. Then which pre-existing weight-related condition would prompt a class 2 categorization?
Categorization.
B.
Categorization.
B
See,
further.
this is the. That's why I said you have to read the topic as well. Categorization. Categorization synonym here is classification. Okay. So definitely it is in B. What single dose of
C. Father.
dose now? Dosage comes where? Ultimately, dose is medication. So immediately you know where to go. So C. Then class 2, you have to highlight those things also. Okay. Class 2 will immediately tell you inside that particular text where to look for. Then what may be impaired if anti-inflammatories are given to patients who take ACE inhibitors?
C. Father.
What may C. Okay. Inflammatories are given to patients who take ACE. This is known as name or abbreviation. Okay. Rush into that particular abbreviation. In the text, go to that abbreviation. What is the single dose of oral?
Dose. Medication. Dose.
Yeah, dose of oral.
C. Father.
Now, dose is again C.
Therapy.
Yes. Then coming back to what is the maximum single dose?
C.
C. Father. Treatment.
Now again C. That's what I'm saying. Immediately you go there. Here, let's check whether they are right. First one is C. Yeah, here is the text C. So we go to class. Okay, what is the class? See what single dose. And class is given class 4. So what you have to do? Go to class 4 immediately.
Class 4.
Then what you have to do? You go to class 4, then you look for this name. Name of the medicine.
Medicine.
Yeah, name of the medicine. You have the name of the medicine here. So what single dose is given here? 2.4 G grams.
Gram.
Right? So those are the things you need to just look into the class, side heading, subheading, then go to that particular name. Normally it's a name or a dosage or whatever. So it is either number or name. Next one is what is the single dose of oral?
Glucosamine.
Okay. So the name is there, right? So what you have to do? Immediately you have to go to the name in the text in the class 1. So what is the single dose? 500. Name is that it is clearly what is the dose. Then yes. Then next one is 14. What is the maximum single dose? Here, right?
Yes, Father.
Yes, it's given here. And you have the clue here. What is the clue? Easiest clue is subheading.
Class
Yes.
4.
Subheading. Class 4, immediately you know where to go. And you have name of your medicine. You have only 3 names here. You have to just see which name and what is the dosage. Now 15. So it may be necessary to carry out dash blisters caused by cellulitis.
D, Father, under management.
Management D. Okay. Prescribing
D,
anti-inflammatories that may be used as an alternative to ibuprofen. When
Affected
prescribing
area.
anti-inflammatories management, right? A patient may have been exposed to infection by swimming in surface water or using dash. Okay. Yeah, it must be. Yeah.
A, etiology.
Yeah, etiology. Yes. Definitely, swimming, using something, all those are A. So A. Next. Conditions such as dash or even metastatic cancer may be mistaken for cellulitis. Right?
B.
B. Okay. Patients with exacerbating cellulitis, a compromised immune system, and those with dash should be hospitalized. Before treatment or
B, Father.
yeah. Patients suffering from dash can experience repeat episodes of cellulitis. Some
Text
other
A under the
yeah, let's check now. Now see, this is another strategy they use. The tick they use here. You see, maybe or and those things will be definitely answered. See, when prescribed anti-inflammatories may be used, 2 things together. Using this one, you see, swimming and using something. So 2 things and or conjunction. That's called conjunction-based question. Whether you understand the meaning of conjunction. Now let's check. Okay, 17th one is in A. Let's check. See here, etiology. The patient may have been exposed to infection by swimming in surface water or using hot tubs. Since it is using, gerund is here, you need to write only hot tubs, right? Yes. Using hot tub. In text A again, let's finish it and go. Patient suffering from dash can, see here, recurrent cellulitis is more common in people who have means suffering from. Patients suffering from, synonym is people who have.
Yes, Father.
Patients suffering
Yes,
from
Father.
recurrent here, repeat.
Yes.
Repeat
Yes,
episodes of cellulitis, recurrent cellulitis. Recurrent cellulitis means repeat episodes of cellulitis. So, patient suffering from dash means suffering from a condition, right? It should be a name of a condition. Patient suffering from dash means it should be some sort of condition. So you have here the answer. Now 18th one you have in B. Now what you have to do, conditions such as means it must be the name of a condition. Or even metastatic cancer, or even, that's what I said, conjunction. They use conjunction in different forms. Or even metastatic cancer may be mistaken for cellulitis. Note that many other common conditions, including DVT, share the same symptoms as cellulitis. Same symptoms means can be mistaken for cellulitis. Same symptoms means you can have confusions. It can be mistaken. The same is also true for rare serious conditions such as metastatic cancer. So if you have identified the names of the conditions when you scanned, these are 2 are names of conditions. And this question is based on particular conditions. Yeah, these 2 names are given here. One is here, metastatic cancer. Yeah, conditions such as
DVT.
or even.
DVT.
So DVT is the answer.
DVT.
So conjunction, how do they use the conjunction? In the text, it is given in 2 sentences, 2 aspects, but they have paraphrased into 1 sentence in the question statement. Is that clear?
Yes, Father.
Yeah. Now text B again, you have 19th question from text B. So now patients with exacerbating cellulitis, a compromised immune system, and those with dash should be. Now you see, as I told you, you can even ignore these things, what comes in between commas. You need not even read those things. Without that, you can find the meaning. Patients with exacerbated cellulitis and those with dash should be hospitalized. In addition, anyone who is immunocompromised, compromised immune system. Immunocompromised, here it is given, compromised. Yes. And those with dash should be hospitalized. In addition, anyone who is immunocompromised, has facial cellulitis, is very younger or elderly, frail, or whose cellulitis rapidly deteriorates, must be hospitalized. Facial cellulitis. Yeah, it's a direct thing. Yeah. Next one is the 10th one. Class 2. Which pre-existing weight-related condition would prompt a class 2 categorization. Immediately, categorization is in text B. Severity, with severity, you can also write classifications. Okay, such expressions, subheadings, main word you can use in bracket or dash, severity dash classification. So you have class 2. Class 2, which pre-existing weight-related condition? Morbid obesity. Obesity means weight. And coming here, 11, what single dose of medicine should be administered to a class 4 patients? Again, you have class 4 here. That's a clue where you have to look into immediately. Class 4, then you have the name of a medicine. So you have to look for that medicine, that's all. Within class 4, look for that medicine. Now, again, the same strategy, you see. Name of the medicine is given. What is a single dose of oral? Immediately, it is single dose means text C. Recommended for the least serious category of cellulitis. See, first line, least serious means first line, right?
Yes,
Hello?
Father.
Yeah, text D, what may be impaired if anti-inflammatories are given to patients who take AC inhibitors? I said you should go look into these abbreviations. When there are abbreviations, you have to look into the abbreviations. So that will help you to immediately allocate the answer in the text. From the keywords, you locate the text, and from the names, abbreviations, or dosage, numbers, you locate where exactly the answer lies. So what may be impaired if anti-inflammatories are given into a patients who take AC inhibitors? Take account of drug interactions. Anti-inflammatories are given to patients who take AC inhibitors. So interactions is a clue there. For example, co-prescribing anti-inflammatories with AC inhibitors or angiotensin receptor blockers may pose particular risk to renal function. What may be impaired? What may be impaired? Renal function. Direct answer, right?
Yes, Father.
And you have 16th one here. When prescribing anti-inflammatory, dash may be used as an alternative to ibuprofen. If initiating an anti-inflammatory, it's obligatory to use ibuprofen or
Naproxen.
I said this is how they trick you with the conjunctions, use of conjunctions. So what is the answer?
Naproxen, Father.
Yeah, you see, that's why I said 2-3 questions will be there based on the conjunction. Which antibiotic formulation is not suitable for treatment of cellulitis? Avoid means not suitable. The use of topical antibiotics as there are unsuitable for the management. It's not suitable. Unsuitable. Not suitable. Unsuitable means you have to avoid, right? Whatever is not suitable should be avoided. So answer is topical antibiotics. Which antibiotic? Topical antibiotics, as these are unsuitable, not suitable. Unsuitable, not suitable for the management, for treatment of cellulitis. For management of any class of cellulitis. Means for treatment of any cellulitis. So topical antibiotics are not to be used. It's not suitable for treatment of cellulitis. Is that clear?
Yes, Father.
Yes, Father.
Yeah, it's as simple as that, but you need to have patience and practice gradually. When you practice, you have to write down the text as well as the corresponding question statement. That's how you get the idea of paraphrasing.